Good day, my dear budding pathology postgraduates. Histology for pathology. And the class shall be on fibrocollagen, fibroblast and collagen. Always, it is a good habit to go back and then start. Even when you are starting a car, it is better to go on a reverse and then to the front, or vice versa. In this case, I hope you people are able to identify the cells. Even if you don't know, just describe. The cells are large. They are round to oval. They are having an empty appearing cytoplasm. Nucleus is hardly discernible, not very prominent. So, and the cells are also seen in sheets. This is a stained picture of it. I am able to see again a vacuolated cytoplasm, peripherally pushed nucleus, empty cytoplasm over here, and the cells are all seen in clusters or sheets. So this is the adipocyte or the fat cell we had seen in the last class. Now, I would like you people to identify and describe the two pictures given. Let us concentrate on the right-sided picture, my right side. I do not know what tissue it is, but then it is, the color is eosinophilic. In histopathology, unless special stains are used, there are only two colors. Hematoxylin, blue for the nucleus, eosin for the cytoplasm, pink in color. So this is a tissue with bundles of spindle-shaped cells, or rather thick bundles. So here, I am not able to see any nuclear material. It is homogeneous, a little wavy, long ribbon-like strands that I am making out. Hardly in one area I am able to see a bluish, maybe a nuclear ribbon. So this is one. This is collagen. And here again, look at this. Forget the dark blue lines. You try to, or these are black lines rather. In between, I am able to find the pink material that I see over here, slightly wavy, hardly any nucleus. The waviness you can appreciate. So this is also collagen. But then there is something called a black one, still more wavy. This is the elastic tissue. So in some, we will be able to see the elastin and collagen together. Both are connective tissues. Look at this picture again. There are two elements. One, again revise what we had seen earlier. I am able to see pale pink bundles of cells. Hardly any nucleus. As I come to the central region, there are elongated cells. This dark one is the nucleus. So elongated spindle-shaped cells. They are the fibroblasts. So we have seen fibroblast-like cell. It accumulates vacuoles. It can get converted into an adipocyte or vice versa. So how many nuclei you are seeing? They are all fibroblasts. But predominantly, if you take a proportion, the majority of the tissue is collagen. A little bit of fibroblast. We can still call it fibrocollagenous connective tissue. On the contrary, look at this picture. Count the number of nuclei when compared to this. And here again, all the nuclei are in one direction. They are quite slender. And the waviness of the tissue, I will be able to make. So these are all fibroblasts. Fibroblasts, what cell can it be similar to? A smooth muscle. But here it will be thinner and the nuclei will be more delicate when compared to the plump nuclei of the smooth muscle. So there is a proliferation of the fibroblasts. over here. And in the periphery, our friend, I'm finding ribbon-like eosinophilic tissue. That is a collagen. Here, there is a lumen, this is a blood vessel. So this is a proliferating fibrous tissue and collagen. Here, less amount of fibroblast and collagen. Look at this, you people will be able to see. Now, there is something called, so there's a collagen over here. This can be a pale matrix. Look at this pale area, it is a matrix. This area is a cut surface of the collagen fibers. And these are all the nuclei of the fibroblasts. There is no necrosis, no inflammation. Fibrocollagenous connective tissue. The splendid one, I would like to thank the R.A.T.S pathology or histology. Here I am finding these bundles of eosinophilic cytoplasm cells. They are the collagen. And these are the nuclei of the fibroblast. There can be a stroma. Look at this person over here. 1, 2, 3 nuclei and a small lumen. So this is a capillary. If there is a single nucleus, large vacuole, I will think of an adipocyte. So fibrocollagenous connective tissue. A few capillaries are seen. This is still better because histology is one. Look at this. Splendid picture. So there are ribbons. Almost it appears as never ending. Pale, eosinophilic bundles. Bundle is an important word because there appears to be a border for each. And as I told you, there are nuclei, elongated cells, the fibroblasts. Here is a nucleus, here is a collagen. Even the collagen will be having very sparse amount of nucleus. Fibroblasts will be elongated and long and more. So this is again fibrocollagenous tissue. More of fibroblast in this case, less over here. They are slightly irregular nuclei. Again fibroblasts. Here's histology. Beautiful source you should not miss. This is a kind of a recapitulation. What all can I see in this? In childhood, you'll be having some question like identify the 6 differences. Here, I would like you people to identify at least 6 components. Kindly do it as a homework. We shall revise this again in the next class. What are all the components? Describe each of them and you shall become more fluent in your histology. We shall curtail it as you people accumulate more and more knowledge. All the real work is done in the rehearsal period. So always rehearse, practice, done all lessons. Beautiful quote. So repetition is the mother of knowledge and rehearsal can be the father of performance. Gracias.